MedShake. Hi, I'm Anca, and this is the place to be to hear about the latest tech trends in healthcare. Today, we are dissecting a groundbreaking study that maps 25 years of digital health intervention strategies. It's one of the most comprehensive analyses ever conducted, involving nearly 1 million participants across 885 studies. Digital health interventions have evolved dramatically, from simple text reminders to AI-driven personalized treatments. But how effective are these interventions? What strategies have truly made an impact, and what challenges still exist? Let's dive into it. Welcome into the Meta Health. Imagine stepping back 25 years. In the early 2000s, digital health interventions were limited to very simple telemedicine services, SMS-based health reminders, and static web pages offering medical advice. Remember those? Fast forward to today, and we have AI-powered virtual health assistants, real-time biometric monitoring through wearables, and blockchain-based patient data security. How did we get here? This comprehensive study identifies 173 unique digital health intervention strategies, categorizing them into 19 distinct themes. These strategies serve as the building blocks of digital health, shaping how interventions are designed, delivered, and evaluated. The research reveals 3 core strategies that have dominated digital health interventions over time. First, guidance, which is providing users with structured advice, tutorials, and step-by-step support to help them adopt healthier behaviors. Second is monitoring, tracking health indicators like blood sugar levels, physical activity, or medical adherence in real time, which is engaging users through reminders, messages, or interactive feedback to sustain participation. What's fascinating is how these strategies have evolved over time. Before 2017, monitoring was the most frequently used approach. Health apps and telehealth platforms focused on tracking user data, often with limited interactivity. However, after 2017, guidance became the dominant strategy, reflecting the shift towards more interactive, AI-powered, and patient-centered interventions. But why did digital health strategies shift after 2017? The shift from passive monitoring to active guidance wasn't random. 2 major developments influenced this change. First, in 2017, the FDA launched the Digital Health Innovation Action Plan, establishing clearer frameworks for digital health solutions. Around the same time, the World Health Organization initiated the first comprehensive guidelines on digital health interventions. Also at that time, advances in AI, machine learning, and real-time data analytics enabled more dynamic and responsive digital health solutions. Instead of merely tracking patient data, health apps could now provide personalized recommendations, predictive analytics, and adaptive interventions. These changes marked a new era, one where engagement, personalization, and patient autonomy became central to digital health interventions. But while these developments have improved healthcare accessibility and efficiency, they also highlight significant disparities. So who's benefiting and who's being left behind? One of the most eye-opening findings of this study is the stark difference between high-income and low- and middle-income countries in adopting digital health interventions. High-income countries dominated the research landscape, accounting for the vast majority of studies and innovations. In high-income countries, digital health strategies have evolved rapidly, leveraging AI-driven diagnostics, precision medicine, and wearable tech for real-time monitoring. In low- and middle-income countries, digital health interventions have been more limited, often focusing on basic mobile health solutions such as SMS-based reminders for vaccination or maternal health education. However, the post-2017 era has seen a promising trend. Low- and middle-income countries are rapidly closing the gap. With the widespread adoption of smartphones and internet access, these countries are now leveraging mobile-based engagement tools, telemedicine, and digital financial inclusion for healthcare. But challenges remain. How do we ensure that digital health benefits everyone, regardless of socioeconomic status? What role does policy play in making these technologies accessible to underserved populations? These are critical questions that healthcare stakeholders must address. Now, what makes digital health interventions effective? The study also sheds light on key elements that drive digital health interventions. Here's what works. Personalization. The most effective interventions adapt to user needs, providing individualized recommendations rather than generic advice. Second, behavioral science integration. Digital interventions that incorporate habit formation, gamification, and social incentives tend to yield better long-term adherence. Third, social and peer support. Apps that include community-driven engagement like fitness challenges or mental health support groups improve user retention. One great example of this is crypto fitness apps, which rewards users with cryptocurrency for physical activity. Studies have shown that gamified incentives increase motivation and adherence to fitness goals. Now let's conclude by talking about the gaps and what needs more research. While the progress in digital health is remarkable, there are still critical gaps that researchers and practitioners must address. First, vulnerable populations remain underserved. Only 26.9% of digital health studies focused on groups such as the elderly, ethnic minorities, or low-income individuals. Second, long-term effectiveness is still unclear. Many interventions show short-term success, but their impact over years remain unproven. Third, ethical and privacy concerns. With AI and digital tracking, who owns the data? How is it used? How do we prevent misuse or bias in health recommendations? These challenges underscore the need for more inclusive, ethical, and sustainable digital health interventions. So what's next for digital health? The study confirms that digital health interventions are becoming smarter, more personalized, and increasingly integrated into everyday life. However, to unlock their full potential, we must expand access to underserved populations, focused on long-term effectiveness, not just short-term gains, and ensure ethical, privacy-protected data use. That's it for today's episode. I hope you enjoyed it, and I will see you soon for another tech adventure in healthcare.